As states face a downturn worse than the Great Recession, McConnell suggests they consider bankruptcy. During the Great Recession, tax collections fell so steeply that state and local governments furloughed and laid off police officers and cut aid to key services like health care, transportation and schools. Some cities turned off streetlights to save on electricity, and Hawaii cut its school aid so much that it closed them down altogether on many Fridays. The current downturn is shaping up to be worse, and bipartisan groups of governors and mayors from around the country have been pleading with Washington for aid to help them keep workers on their payrolls as they grapple with a growing public health and economic crisis. But Congress did not provide money for state governments in the new $484 billion aid package that the House was expected to pass on Thursday, after Democrats failed to persuade Republicans to do so, setting up the next political battle over pandemic relief. Senator Mitch McConnell, Republican of Kentucky and the majority leader, made it clear that he was reluctant to give them federal aid, suggesting that some should consider bankruptcy. "I think this whole business of additional assistance for state and local governments needs to be thoroughly evaluated," Mr. McConnell said in an interview with the conservative radio host Hugh Hewitt. "There's not going to be any desire on the Republican side to bail out state pensions by borrowing money from future generations. It is true that some states, including Illinois, were struggling with enormous pension fund shortfalls before the pandemic sent the markets plummeting, eroding the values of their funds and adding to their current budget woes. But many states and cities that were doing well before the virus hit are now seeing their tax collections fall off a cliff, which could force them to furlough and lay off workers and cut services as the crisis has driven needs higher than usual. States now do not have the ability to declare bankruptcy to reduce their financial obligations, but Mr. McConnell raised the possibility of letting them do so. "I would certainly be in favor of allowing states to use the bankruptcy route," he said. The National Governors Association, a bipartisan group of governors from around the country, wrote federal officials this week pleading for $500 billion to help them make up for lost tax revenues during what they called the most dramatic contraction of the U.S. economy since World War II. These continuing losses will force states and territories not only to make drastic cuts to the programs we depend on to provide economic security, educational opportunities and public safety, but the national economic recovery will be dramatically hampered, the group's chairman, Governor Larry Hogan of Maryland, a Republican, wrote with its vice chairman, Governor Andrew M. Cuomo of New York, a Democrat. Mr. Hogan said in an interview with Politico on Thursday that he thought Mr. McConnell would come to regret his remarks. "The last thing we need in the middle of an economic crisis is to have the states all filing bankruptcy all across America and not able to provide services to people who desperately need them," he said. Governor Jay Inslee of Washington, a Democrat, was blunter, calling Mr. McConnell's comments nuts in an appearance Thursday on ABC's The View. Mr. Trump gave ambivalent signals at his White House briefing on Thursday, suggesting that he might be open to offering aid to the states but also saying, "It is interesting that the states that are in trouble do happen to be blue." In New York State, where officials were forecasting a shortfall of between $10 billion and $15 billion, Thomas P. DiNapoli, the state controller, wrote in a report this week that the crisis had left greater uncertainty this year than ever before as to the level of funding the state will be able to provide for school districts, health care providers, local governments and others. Mr. McConnell's staff issued his statement under the heading, "Stopping Blue State Bailouts," which suggested that the top Senate Republican was singling out heavily Democratic states such as California, Illinois and New York, which have been hit hard in the pandemic. Mr. Cuomo accused Mr. McConnell of hyperpartisanship, calling the blue state bailout label vicious. "How ugly a thought," Mr. Cuomo said Thursday. "Think of what he is saying. People died, 15,000 people died in New York, but they were predominantly Democrats, so why should we help them?" Coronavirus becomes leading cause of death in LA County as toll nears 800. Los Angeles County health officials on Thursday announced that COVID-19, the illness caused by the coronavirus, has become the leading cause of death in the county, surpassing fatalities from flu, emphysema and heart disease. Barbara Ferrer, the county's public health director, confirmed 68 new coronavirus-linked deaths, bringing the total to just under 800 since the outbreak began. The county also reported 1,081 new COVID-19 cases, pushing the overall number to 17,508. Of those who most recently died, 51 were over age 65, 11 were 41 to 65 and 3 were 18 to 40. Ages were not available for the other cases. Among all who have died from coronavirus infection in the county, 89% had some kind of underlying health condition, Ferrer said. This is underscoring the need for people who have underlying health conditions to make sure that they're staying home, that they're avoiding close contact with as many other people as possible, and that at the first sign of illness they are contacting their healthcare provider, she said. The average number of daily deaths related to the coronavirus in Los Angeles County is 44. In comparison, each day, 5 people die from influenza during flu season, 8 die daily from emphysema and 31 die of heart disease, on average, Ferrer said. These are our leading causes of death across the county, and at the average rate of 44 deaths per day. COVID-19 has now become the leading cause of death across the county, she said. These numbers are a stark reminder for all of us of the importance of slowing the spread of COVID-19, because in slowing the spread, we have the opportunity, each and every one of us, to save a life. The increase in deaths in Los Angeles County comes a day after California reported 118 new fatalities, the highest number of deaths in a single day statewide. More than 1,500 people have died across California. The surge in fatalities marks a roughly 8.5% increase in the number of deaths statewide, Governor Gavin Newsom said Thursday. It's a reminder we're not out of the woods yet, he said. Despite the uptick in deaths, public health officials say hospitals are not being overwhelmed, but they continue to see a steady flow of patients. Models unveiled this week project that, should residents continue to abide by stay-at-home orders and maintain social distancing when they do venture outside, Los Angeles County should have enough hospital and ICU beds, as well as respirators, to accommodate the expected number of coronavirus patients. The sobering numbers come amid a push from some communities to loosen regulations that have kept Californians inside for weeks. A group of protesters on Wednesday drove around City Hall in downtown LA, honking and waving signs reading "Open Cali Now" and "Freedom is Contagious." Some held signs supporting President Trump. It was the latest of several protests across the country. In the past several days, similar uprisings were held in San Diego, Newport Beach, Sacramento, Huntington Beach and San Clemente. Orange, Riverside and Ventura counties have started to pull back on some of their coronavirus-related restrictions, reopening golf courses, parks, beaches and other outdoor areas, as health officials in LA County urge residents and public officials to stay the course. Newsom re-emphasized this week that there are 6 key indicators for potentially modifying the stay-at-home order. Among those is increasing testing capacity, which he said may be among the most important. Currently, the state can provide about 16,000 tests a day, he said, and the goal is to boost that to 25,000 a day by the end of the month. Counties across the state have also started boosting their testing capacities in recent weeks. Los Angeles County expanded coronavirus testing this month to include any resident who has symptoms and wants to be tested for the virus. Orange County this week launched a network of 6 clinics that officials say will have the ability to test an additional 600 people per day. The tests will be done by appointment for anyone showing symptoms of the virus. Between 350 and 1,100 people were previously being tested for COVID-19 per day countywide. Eventually, county health officials hope to be conducting 2,000 tests per day through the network. Orange County public health officials reported 2 additional coronavirus-related deaths on Thursday, bringing the toll to 36. There have been more than 1,800 confirmed cases of the virus in the county. Newsom and others have said that California and the nation have not necessarily seen the worst of the coronavirus and that lifting stay-at-home rules too early could be disastrous. Ahead of the unseasonably warm weather expected this weekend, state and county officials encouraged Californians to stay at home as much as possible and avoid crowded outdoor areas. If people fail to social distance this weekend, the governor said he expects to be announcing a rise in the number of deaths, hospitalizations and new infections in the coming weeks as a result. Los Angeles County Supervisor Hilda Solis emphasized that while the warm weather may look like an exciting opportunity to head outside, it is more important than ever that people continue social distancing efforts. This will test our resolve to remain committed to the safer-at-home orders, she said. Now is not the time to let our guards down and lose the gains we have made. Times staff writer Phil Willen contributed to this report. Wednesday was California's deadliest day, with 115 deaths, though Pence predicts an end by Memorial Day. Governor Gavin Newsom of California said Thursday that the state had experienced its deadliest day since the start of the pandemic, with 115 COVID-19 deaths on Wednesday. That brings the total number of those lost, each one representing an individual and a family torn asunder, as Mr. Newsom has repeated in his daily news briefings, to 1,469. The Los Angeles County Department of Public Health reported 68 new deaths on Thursday. COVID-19 is rapidly becoming one of the leading causes of death among LA County residents, Barbara Ferrer, the county's director of public health, said in a statement. According to the Times' tracking, there have been 37,866 confirmed coronavirus cases in the state. Nonetheless, the White House remains resolutely upbeat. Vice President Mike Pence predicted on Thursday that epidemic will be largely behind us by Memorial Day, on May 25. Honestly, if you look at the trends today, I think by Memorial Day weekend we will largely have this coronavirus epidemic behind us, he said on Geraldo Rivera's Cleveland radio show. We're getting there, America, Mr. Pence said at the nightly White House news conference. The California governor was more somber than that. While Mr. Newsom noted that hospitalizations and patients in intensive care had decreased slightly from the day before, he said the number of deaths should serve as a warning that even as the weather warms and Californians may be tempted to flock to beaches or gather outdoors, the virus was still an insidious force. Let's not dream of regretting, he said. Stay home to the extent possible. He also urged patience for local leaders and other Californians who had asked when the state would ease orders to stay at home. It's not a date, it's an indicator, Mr. Newsom said, referring to the list of 6 broad measures his office laid out last week that would determine when it would be safe to loosen some restrictions. One major issue is that the state will need to significantly ramp up testing capacity, which Mr. Newsom's office and a state task force have been working on. Legions of contact tracers are also being trained to help track and halt any outbreaks. Still, Mr. Newsom on Wednesday announced a first modest step in that direction. Hospitals would again be scheduling what are called elective procedures, a term that can include medically necessary procedures like tumor removals.